Hello, friends. Today we are going to learn about hand washing, why it is so important, what is the outcome, what is the purpose behind that. So, the outcome of the hand washing, it but obvious to enhance the awareness about the infection control measures and the purpose of the hand washing is to prevent the transmission of the microorganism. As we all know, uh, nowadays people getting sick and ill just because of they are much more lean to getting infection by touching, by coughing. So it's always important to make yourself hygiene and clean as always. So why it is important at workplace, because we are touching too many files, the things, clients or patients. So it's always better to make your hands clean and tidy so you are not be a witness to spreading the infection. Let's get started. So the first step is always roll up your skin. Your sleeve should be like this. Pull it up. The reason behind that, we need to clean your whole hands, okay? And then remove the ornaments or any jewelry, because sometimes they has launch infection on it. So it's better to keep away from the sink. Keep away your clothing or your uniform from the sink, because sink has a lot of microorganism infection. So it's better do not touch to transmit the infection from the sink to your uniform. Later on, we are going to start the procedure of hand washing. So we need to on the tap. So always check the intensity of the flow and the temperature of the water. So the water should not to be too fast or too low, because if it is too fast, then it will splash the infection with the water all around this sink area, which we don't want. Always check the temperature of the water. It not should be too cold or not should be too hot. It should be lukewarm water, just because if our skin is oily, then oily skin may attract the infections. So it's better to remove the oily skin by the lukewarm water. After rinsing the hands, and your hand should be 3 to 2 inches below, so your less contaminated portion would be under the water, and water should be thoroughly clean your wrist less contaminated portion to the most contaminated fingertips, like this way. And then after, you need to take some soap, whether it is your liquid soap or your bar. If you are taking the liquid soap, then pump at least 1 to 2 and it should be in a quantity of 3 to 4 ml in your palm, and spray it on your dorsal aspect of your hands. If you are taking soap, today I'm going to use this one only, but if you are taking your soap, then you need to use it, rub it in your palm, in between your palms, and then apply thoroughly on your wrist area to the fingertips. And then after, you have to rinse it out and put it back on the top of the bar, so it's not gonna be contaminated the plate. The next step, we need to rub our hands back and forth like this way, so we can clean the interspace of digital area. Both the hands properly. You need to roll your wrist side by side like this way, and then after your thumb, whether it is right or left, and then your fingertips, which is most contaminated, roll like this way. By chance, if you touch the sink, you need to follow the procedure again, like this way. And after, you need to clean your hands thoroughly, at least for 15 to 30 seconds. So your all soap will gonna rinse it out properly. It should be on your wrist, dorsal aspect, fingertips, and your thumb, and it's look good. And then after, instead of taking the napkin or towel, the regular one, because if you are using, again and again, then you can get the infection by the towel only. So it's better always to take the paper towel. Take a paper towel and dry your skin, because it's better to clean your hands because it's always most contaminated than the forearm areas. And then throw it out. Take another paper towel. Two of your tap, and then throw it again. So most of the time, dry skin, it's become chapped, and chapped skin, it's break down, and the breakdown skins always keep the infection in it, in between the breakage area. So it's always better to keep clean your hands whenever you touch your patients or touch anything. So it's always better to wash your hands once you start your work, or as soon as you are there, you have to clean your hands first and then start your procedure. Thank you so much.